Do you plan on birthing alone as a free birth? Is that what you want to do? And or an unassisted birth? So free birth, funny word, unassisted, not accurate. You should definitely have the people who are with you and love you to assist you and help you. What they're saying is that you're choosing not to have a birth professional with you, which is absolutely fine. I mean, women all over the world don't have birth professionals with them when they give birth. Is it always their choice? No, there are a lot of women who give birth because labor happens quickly. They didn't plan it at all. They're in the car, they're going out the door, they're in the parking lot of the hospital, they're by the rice paddy. Birth happens, and sometimes it can happen very, very quickly. If we plan to have a birth where there's no birth professional with us, then it's just like any other home birth, really, is that you just need to be skilled and to be responsible so that you don't get fixed on the ideology of having a home birth if you feel that there's an issue that needs to be dealt with. It's as simple as that. Many of the families, Birthing Better families, that were very highly religious were going to birth at home without a birth professional. There weren't very many birth professionals around in the 70s in the U.S. anyway. So if we had home births, many of us birthed without a birth professional there. And by and large, our births were fine. If we had to go into the hospital, we just use our skills. What can we say? I guess what I want to convey to you, having been involved in this conversation for 50 years, is that the ideology around childbirth did not start until the 1980s. The separation that women have done to ourselves, which just drives me absolutely round the bend. I had a home birth. You had a hospital birth. So what? My baby was a home birth, but her brother was a cesarean. So what? I mean, really, we have to stop this. This is where women are so unpleasant to one another. If you are choosing to have an unassisted birth at home, do it. Do it safely. Do not do it because you're so ideologically bent that you would risk yourself or your baby. It's as simple as that. Why would you want to do that for an ideology? For what purpose? Well, the reason is because, back to the natural birth movement, when I gave birth in the 1970s, we went into the hospital and had an expectation that we would have assessments, monitoring, and procedures. That's what we called them. In the 80s, the natural birth movement put all of them into one word, interventions, with a strong implication, and you know this, that they're unnecessary and imposed on you, and that women should have the choice to say no to interventions. When I teach midwives, and I say to midwives, particularly in New Zealand, where our trust is, and I lived for 25 years, we say to midwives whose philosophy is that pregnancy and childbirth are normal life events that rarely require medical care, so their profession is very dedicated to the natural birth movement, natural birth model, and home births. You ask them, what's your goal? Have more natural births? Fine. What's stopping them? Interventions. Okay, let's make a list. You make a list. How many things do you think are an intervention? If it's more than one, you have to avoid two. If it's more than two, you have to avoid three. If it's more than three, you have to avoid more than three. Well, the list that midwives give in New Zealand is 20. Okay, not being able to get out of bed, not being able to eat, not being able to get into water, having a vaginal exam done. I mean, name it. Inductions, ruptured membranes, fetal monitoring, vaginal exams, name it. If those are all interventions and you are at home because you want to avoid all of those interventions, then that's an ideology, which means that you're more focused on avoiding something than protecting the health and well-being of your baby. You don't want to do that. Okay? If you have your baby at home without medical care, it's a wonderful experience. It's intimate, and it's sharing, and it's caring, and you want to make certain that you have skills if something happens. either to take care of it at home, no different than if your kid choked on something, no different if your kid got into the sink and drank something that was poisonous. You need to have skills, not ideology. So maybe you're going to stick your fingers in your ears and go, da 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 da, I don't want to hear that, but do hear that. Because the Birthing Better families who developed these skills, many of them were very, very religious, which meant that they trusted in their God or their higher power. But they always said this: my God provides, I do. So none of these very high risk people, women who were having births without medical care, intentionally put themselves in la-di-da risk. We learned skills so that we could reduce and prevent those risks from happening. So please follow our lead. Become highly skilled and then deal with whatever happens. If you absolutely feel you need to go and seek medical care, don't hesitate to do that and use your skills. This is your baby's birth. You didn't get pregnant to have a type of birth. You got pregnant to have a baby. And honestly, your baby doesn't care where it's born. It gets born in wars, it gets born in famine, it gets born in starvation and abuse and slavery. Babies don't care where they're born. They care about how you treat them.